Hello, and thank you for joining me again in this session. So, I want to talk about COVID-19 and its effect on the economy, its effect on the people of Nigeria. Of course, this is affecting everybody around the world, but in Nigeria in particular, we saw, a post recently from the Presidential Task Force. It was posted on Twitter that about 100 persons have been banned from traveling out of the country from anything that has to do with traveling. About 100 passports have been seized by the PTF, which is the Presidential Task Force on COVID-19. And according to them, these people failed to do the 7 post arrival COVID-19 test, which is expected by everyone who are just coming to the country, that after 7 days you should have yourself tested of the virus, do a PCR test so that it will be confirmed that you don't have the virus. But about 100 people recently that came into the country didn't do that test, and they have been sanctioned. Their numbers, their passport numbers have been posted online, and it has been said that they have been banned from traveling. Traveling restriction has been placed on their passports for 6 months, from January to about June, that they cannot leave the country. So this is more like a way of sending out notice to others also who are traveling, to know that, okay, if you fail to do this, you will be sanctioned, you will be punished, because you are endangering the lives of others. I mean, this period, that even now that we have a new strain of COVID-19, it means that things are getting even serious and getting worse. And, with what we're already expecting, that this January is going to be very tough, because given the celebrations that people have had in December, so it means in January we might be expecting an upsurge, in the infection rate of this COVID-19. So everybody is supposed to be careful. So, and for those who have traveled and came into the country and are not actually heeding to the instructions, is a bigger issue for those who are already in the country that have been exposed right now, because you don't know what these people are coming back with. You don't know where they went to, what they did, the events they attended, and people they interacted with. Maybe they're coming into the country with the virus. Who knows? And then when they come now and mix up with others, it might also increase the infections in the country. And who knows if they're even coming back with a new see, with the new strain of COVID-19. But God forbid. But the thing is that if you feel okay, if you feel like you don't have any of those mentioned symptoms of COVID-19, people are actually reluctant to take those tests, because some people still don't believe in this COVID-19. Some people don't believe it is real. Some people still believe it's a scam or it's a sham. And also, if you don't feel like you are having all those symptoms, you don't have cough or all those things like that, you don't see the reason for doing those tests. And if you do those tests, if you're afraid, okay, maybe they can just declare you, as being positive or having the COVID-19 when you're actually feeling all right, and then, it becomes a problem for you. But also, importantly, what people are actually not happy about is the fact that government is making money from these things. I mean, we've heard people complain about how much they pay to do a test, that the government doesn't really care if you have positive or negative. They just want to know that you have done the test. They just want to know that you have paid the money. I mean, we had a case of a musician in China, in Ghana, that complained about him making those payments. Meanwhile, he made a test from where he was coming from, the country he was coming from. He did the test there before leaving the country. And when he came to the country again, he was mandated to do another test. Not really to do the test, but to pay money. That indicates that he has paid money for the test. And they don't really care. They didn't really even bother to check to know if the test he did, he was he came out negative or positive, whether he had the virus or not. They didn't really bother check. What they just wanted to see was a tally. They really wanted to see the receipt of payment, which is very pathetic. I mean, he felt very bad, and he came online to talk about it and be like, does this government really care about us? Do they really care about our health, or they are just after making money? So when you start feeling like that, when you have people that feel like that, they'll be like, it doesn't really matter if I'm positive or negative. The government doesn't care. It's all on me to take care of myself. What the government wants is my money. So as long as I give them their money, I'm free to go, even if I have the virus. So I think the government also on their own part should do enough, to ensure that it's not just about the money that people are paying for this test, but also that they are actually doing the test. And the test, they actually care about what the person has. If the person has the virus or not, they proceed to the next level. So this was announced by the boss Mustafa, which is supposed to be the chairman of the PTF. But we hope that they do much more, to encourage people to actually do this test. It's difficult for people to agree to these things. I mean, we've seen people, people of a particular faction, religious faction and things like that, not believing in the COVID-19. And nobody's forcing anybody to believe in the COVID-19. But when you see these things happening of death, when you start hearing death rates, you start wondering, well, if you don't believe this is true, then why are all these people dying? And then some people will say, okay, maybe people already have other kind of illnesses. When people die this period, they just, slam them with the COVID-19 issue and say, okay, they had coronavirus and things like that, even though they don't have it or something like that. But will it be that all the people that have died so far didn't have anything to do with coronavirus? These are questions that people should ask, especially those who don't still believe that this thing exists. I'm not saying it doesn't exist. I'm not saying it does exist, but I know what I believe in. But for those who don't believe that it does exist, I mean, they should actually try to not just protect others also, but protect themselves. Okay, if you don't believe it exists, what if it does exist? And then you have not been taking care of yourself, you have not been protecting yourself, you don't wear mask, you don't use hand sanitizer, you don't keep social distance, and eventually it becomes true that it does exist, and then you get infected. What are you going to do? So I think people should do much more. Wear a mask, keep social distance, use hand sanitizer as much as you can. Try to prevent yourself from getting this disease so that it doesn't become a problem to you and your family. But for that now, I hope that those that are traveling also, get this announcement or get this post or also get this warning by the Presidential Task Force on COVID-19 that if you don't do your day 7 post-arrival test, that you can actually suffer from it. You can be banned from traveling for 6 months. So bad news for those who are traveling, who are not complying to this rule. And if you want to get out of it, if you don't want to be a part of those that have been banned or sanctioned from traveling, then just do the test and get away with it. That's what I have to say. Thank you for listening and see you in the next one.